I think that might be our cue. Good morning, everyone. This is our take two for our first session of the summit. So again, good morning. Welcome to the Health Equity in Action, Libraries, Communities, Opportunities, a summit hosted by the American Library Association Social Responsibilities Roundtable, or SRRT for short. SRRT believes that libraries and librarians must center social responsibility by recognizing and helping to solve problems and inequities to work for the common good. I'd like to introduce myself. My name is Alicia Columbell. I will be serving as your moderator for today. I'm kindly joined by Julie Winkelstein on chat and Hillary Pearson as our tech person for this session. To enable captions, please click More in the bottom right of the screen and then click Show Captions. Our session today will be recorded and the recording will be available on our website within a few weeks. Please, as a reminder, keep your cameras off and your mics off unless you are a presenter for today. This session focuses on helping libraries understand their role in promoting community health. We have three presenters with us today, and I will introduce them in the order in that they will speak and their presentations. We have Noah Lenstra, professor at the University of North Carolina at Greensboro in the Library and Information Science program, who will be presenting public library participation in community-based health coalitions. We also have Larry Daniels, library manager for Durham County Library, who will be presenting Native Tongue, the public library's role in assisting healthcare professionals with community health advocation. And our third speaker for today will be Gail McCray, who is faculty for the Morehouse School of Medicine and will be presenting public libraries, health literacy, and health equity partners hidden in plain sight. So we are going to go ahead and kick things off. We will be taking questions for the panelists after all of the presentations. Please use the Q&A feature to pose those questions, and you can do that at any time. Please reserve chat to relay any technical issues, as some of you kindly already have, resource shares, or appreciation for our panelists. Thank you, and go ahead, Noah.
Great, and I'm just sharing my screen here. Hopefully it's working. Good. So again, I'm Noah Lenstra, UNC Greensboro, and I'll be talking about the value of public libraries participating in community-based health coalitions, and also explaining a little bit about what these coalitions do. And again, the goal of these coalitions is to kind of create a culture of health, which is not something that any one institution can create by itself. A hospital can't create a culture of health. A faith-based institution can't create a culture of health. A school can't create a culture of health. A public library can't create a culture of health. But those institutions working together can create a culture of health. And so that's what we'll be talking about. And so just to kind of begin this, the Knight Foundation recently interviewed Maureen Hartman, director of the St. Paul Public Library, just really asking her some questions about what does it mean to be a public library director? What does that work look like? What are some of the challenges that you navigate as a public library director? And when the interviewer asked, what are some of the biggest challenges you have as a library director, Maureen responded, sometimes we're left out of important community conversations when we know we have an important role to play. So this really speaks to, in this context, she was talking about the opioid crisis. She was talking about homelessness, but really any kind of health issue that you can think of in a community. And in many cases, those issues are going to be present and visible in the public library. But the reality is, most people, when they think about how do we address those issues from a community perspective, most people don't think, oh, we need to bring in the library director, or we need to bring in the youth services librarian, we need to bring in the adult services librarian. So how do we address that? In parallel, over the last decade, there's been a big increasing interest in what are called digital inclusion or digital equity coalitions. So there's now kind of increasing recognition as we see in kind of articles in American Libraries Magazine in 2018, 2022, in a recent research article in 2025 on the best way for public libraries to address the digital divide is to do so in coalition with other entities. So looking at kind of examples from around the country, and really, in the most recent NTIA federal funding, putting up quite a bit of money, as you see here, for digital inclusion coalitions, with the idea being that if we really want to address the digital divide, we can't just have hotspots and computer labs. We really need to have community organizations working together to get at the root of these issues. So again, digital inclusion coalitions, these have been documented since 2018. There's a lot of research. We have kind of this National Digital Inclusion Alliance, kind of providing field-wide infrastructure, often centering public libraries as leaders in digital inclusion. But when we think of health in public libraries, the conversation is often quite different. We know that libraries often participate in community-based health coalitions, but that participation is largely invisible, it's largely undocumented, and it's largely unarticulated. There's not really the same kind of research infrastructure, and there's nothing equivalent for the National Digital Inclusion Alliance in terms of health in communities. So that really brings me to the research that I've been doing, which is really trying to answer this question: what does library participation in health coalitions look like, and what does it produce? And so I'm not going to be sharing everything that I've been doing, but I did. Some of you may have completed it. We put out a survey over the winter and got about 200 responses from public libraries. I've also been doing some interview-based studies. So this is just going to basically provide kind of a brief snapshot of some of the findings without going into too much detail about methodology. But I believe a picture says 1,000 words, as they say. So these are just some of the examples of kind of the community coalitions that public libraries are part of across America. Everything from coalitions focused on physical activity, Activate Elgin in Illinois, the Healthy Anne Arundel Coalition in Maryland, Healthy Paducah in Western Kentucky. We also have coalitions that are focused on topical issues like the Greater High Point Food Alliance here in North Carolina. We have coalitions that are affiliated with state health departments, like this Health Equity Partnership of North Central Massachusetts, which is a constituent part of the state health department. We have Healthy Gallatin, Pella Wellness Consortium in Montana and Iowa, and just wanted to kind of give a few examples. Again, won't go into any great depth into any of them, but just wanted to. So in Western Kentucky, the McCray County Public Library has been a key member in the Healthy Paducah Coalition for years. So they've kind of worked with the coalition on everything from bringing flu shots to ending homelessness. In Iowa, the library has been part of the Pella Wellness Consortium. The library director has in the past served as the treasurer and has contributed governance templates for this new coalition. So the library was kind of at the beginning of the coalition, and as a result, kind of played a key role in kind of bringing this coalition to life. In Massachusetts, the Wake Up Prevention Coalition is a 50-plus drug-free communities coalition. The library has, as part of its involvement in this coalition, hosted mental health first aid trainings and is a listed partner on the website. I mentioned Activate Elgin. This is a coalition that has as its primary functions to do kind of a community-wide nutrition and physical activity programming every month, March for National Nutrition Month. So the Gail Board and Public Library is structurally embedded in the coalition and has been since its inception. So some coalitions, as I mentioned, are kind of more part of state leadership. So in Massachusetts, they have these community health network areas. The Bigelow Free Library has participated in this state health department ACRED coalition. And through that, it's gained access to health evaluation frameworks, which would be kind of beyond the wheelhouse of anything a public library would normally have access to, as well as funding. And finally, just going to South Dakota, the library director in Lake Andes have again played a key role in kind of creating this Lake Andes Food and Wellness Council, and through it has circulated canning kits through the coalition's Preserve and Prosper program. And so the main reason I wanted to kind of just give these brief snapshots is to really illustrate there's no kind of one way for kind of public libraries to participate in these coalitions. And similarly, there's not one type of coalition that is the one type of coalition for public libraries to be part of. There's kind of as many opportunities and as many coalitions as there are communities in America. But digging a little bit deeper, one of the things that I've seen in my interview research is that from talking to other members of these coalitions, the default position for libraries to be kind of positioned in is a resource. So that the library is seen as, oh, here's a space for us to go to distribute information. Here's a space that we can use to deliver programming. So in that resource framing, the public library is used by the coalition, but it's not necessarily part of the coalition. So that often is the default status until someone from the library speaks up and says, hey, we want to be more involved in these conversations. We don't want to just be kind of a resource that you all use. We want to contribute to the conversation. So that can then lead to the library becoming a contributing partner, going to meetings, sharing some of the things happening at the library, helping develop shared goals. In some cases, that participation kind of transitions into becoming more of an embedded partner. So rather than simply a coalition, someone who might show up for a meeting now and again, kind of seen as kind of a core part of the coalition, listed on the coalition website as a member. And as I said, in some cases, the library is even a governance partner. So it could be the treasurer, it could be part of the steering council, it could be really just one of the anchor institutions without which the coalition would kind of cease to function or exist. And so just to kind of give a snapshot, as I said, as part of this research, I've talked not only to people who work in libraries, but also other members of these coalitions to kind of hear what does it look like from others' perspectives. So Christy Leonard, who helped found this Pella Wellness Consortium in Iowa, told me that she invited the library director to join because the library's approach to wellness, social, intellectual, occupational, expanded the coalition's own sense of its mandate, kind of bringing new ideas and new perspectives into the coalition that wasn't necessarily there. And so one of the ways that this kind of coalition participation directly benefits the library, in addition to benefiting the community, it is contributing to what I call kind of the turning point. So it helps shift from librarians going out seeking partnership opportunities, seeking opportunities to work with others, to instead kind of that dynamic gets turned around. and partners start seeking out the library. So April Young, director of the Rutherford County Library, talks about the moment it changed, the moment that things shifted from the libraries having to go out, hit the streets, round up partners, to the partners just naturally knowing, oh, the library is part of our public health infrastructure. Of course, we want to go to them to kind of think about ways that we can collaborate to get at the root causes of social and health inequities. So just kind of shifting outward from the research to some of its implications. So in the survey, one of the things that I found, so I mentioned 194 of the survey respondents kind of listed a community coalition. So there was 323 total responses. So again, 194 or 60% kind of attested to being part of a community coalition. 13% said they were not part of any coalition. And for about a quarter of the respondents, there was a lot of confusion about what this term coalition even meant. So even though I thought we explained kind of pretty clearly in the survey instrument, we're talking about community-based coalitions composed of entities of multiple sectors. Fully a quarter of our survey respondents listed a library organization, so maybe the North Carolina Library Association or kind of a regional library consortium. So what this finding tells us is that there's lots of people working in public libraries who have low coalition literacy. And what I mean by that is they don't really understand what community coalitions are. They don't understand how they operate. They don't understand how to find them. And they definitely don't understand how and why they would go and want to kind of get a seat at a table. So that's an educational thing that we can work towards. We can work on improving that coalition literacy within the library workforce so that we can drive more of these outcomes. Just a few other challenges as I move to wrap up. So sometimes the lack of agenda can be an issue. Sometimes when coalitions get started, there's a lot of kind of people just getting to know each other. Librarians have a lot on their table. So it can seem like, well, I have so much that I have to do right now. Why would I go and sit with a bunch of people with that doesn't have a clear agenda, and I don't understand how I fit into it. So there's those issues of time, capacity, agenda. And also staffing transitions. This personal precondition, we saw a lot of instances where it was one staff member from the library who was kind of the library's coalition person, and when that particular staff member left, the whole kind of enterprise could kind of fall apart, sometimes literally. So just wanted to kind of end as I'm running out of time with kind of my vision for the future. So this is kind of my vision for the future. So this city in Iowa a couple years ago got a $50,000 grant to create a community-wide healthy eating, active living plan. And so why this is my vision for the future is who was on the implementation committee. So we had some people that you might expect. We had public health, we had parks and recreation, community development, schools. But then, oh, we have the public library director. So this is what I want to see. This is my vision. This is my goal. This is my dream. Whenever there's folks kind of gathering around a table talking about how are we going to improve the health of our community, I want someone from the public library at that table. And really, my last message: coalition participation is not a nice to have. It's a primary mechanism through which a library becomes what a community needs it to be. St. Paul, Maureen Hartman named the problem. And so let's figure out how to do it. And I'm going to stop there. Thank you for your time. And yeah, look forward to the Q&A at the end.
Thank you so much, Noah. Our next panelist is going to be Larry Daniels.
Trying to share my screen. All right. Here we go. So again, my name is Larry Daniels. I am a library manager at Stanford L. Warren Library, located in Durham, North Carolina. Uh, I wish we was live and we was in front of each other so we can, have conversations and I could get y'all reaction. It's hard to do stuff when I don't see any faces. But what we have pictured is if you are a fan of Stanford and Son, you might notice that these gentlemen right here, the police officers, Smitty and Hoppy, I see a heart. So that somebody's with me. And so they usually pop up in scenes where, they go and investigate or go see you know, the junkyard where Fred and Lamont is working. And usually Hoppy is speaking in terms of cop language and law language, and Smitty has to kind of break it down so Fred and Lamont can understand. And towards the end, when their scene is over, Hoppy was trying to say something cool, and so he can show that he's down with Fred and everybody, and Smitty will have to correct them. And so this is kind of our position as part of being the language of our community. So there will be some overlap during this presentation with Noah. I promise you, we didn't work together on this presentation, but you'll kind of hear some stuff that was similar. Let's see. All right. So the purpose of this presentation is to highlight the importance of library staff's engagement with the public who are frequent visitors of the library, and the importance of analyzing information behavior among library users. Librarians' role of being an accessible spokesperson for the community. So just like what Noah was talking about, somebody that's going to show up to be a part of these coalitions and health groups, to be the voice and speak for the community that they serve. And just developing a relationship. And going back to what Noah was saying, utilizing library resources, whether it's opening the space, being a space where they can hand out flyers or leave pamphlets that can play a major role with connecting healthcare professionals with the community. And mostly this is to present a model example of how libraries can assist vulnerable communities. So give you all a little background. So for those who don't know about Durham, North Carolina, we are part of the Research Triangle region, which consists of Raleigh and Chapel Hill. Stanford L. Warren is located in the historic Haytide District, which is located on the south side of Durham, that is part of the Durham County Library. So we're part of the Durham County Library system, is one of seven locations. The majority of our library users patronize Stanford L. Warren are typically residents who are historically marginalized. So we get a lot of people who are, suffering from houselessness, suffering from drug addiction. We got people who are, kind of lost their way. And so these are people that's kind of, what happened? Just going back. Kind of lost their way. Sorry about that. And while we're in this location, where we serve a lot of marginalized people, we get a lot of visitors from our research institutions. And so that's Duke University, University of North Carolina, the Research Triangle Institute, some of you may or may have not heard about, North Carolina Central. They visit to drop off flyers, and they want to do studies to analyze the people who are frequent visitors. And so we get many health coalition groups within the Research Triangle area who are interested in assisting the people who live in our community. And here's a little observation that we've taken as a library staff and library unit. Researchers are asking librarians to assist with these community engagement. We living in a time where community engagement is starting to shrink. You could read the studies on New York Times or any of the publication about the amount of people that's going to church, the amount of people that's going in social settings. Well, we're still having people to come in to the library. We're probably one of the last places where people are gathering and meeting and doing their research or using our facility. The majority of the researchers are asking for collaboration are either medical students or young in their profession. So being set in Durham, North Carolina, being where we got Duke and UNC, a lot of the medical students are eager and want to know, like, well, how can we make a difference in the community? And so library staff are becoming an intricate part while assisting individuals who are going through mental health challenges. Some of these students are seeing those things and what roles we're playing. So we are in a unique space, being where our library is. And also, some of the trends that we're seeing around is the growing demand for using library spaces. Many of y'all probably live in places where you'll see buildings for lease or buildings that's got have high rent. Well, we're one of the last places where you can go and utilize our space free or cheap. And so we're getting a lot of people who want to utilize space to have meetings, do programs, and do a lot of collaborations with us. But one of the key things that I want to bring up, and I never thought that I would be doing a presentation like this to mention this, and a lot of people in the public libraries or any library will observe this. Visitors of the library are intelligent. And some of you may think like, well, duh, of course they're intelligent, they go to the library. But when we're assisting patrons using the computer, somebody needs help typing or opening up a computer screen or wanting to print or need assistance with checking out a book. There's always somebody that says, yeah, you're helping me with this, but I know this. And it's kind of a counteractive command of a library user saying, well, I may not know this one thing, but I'm very knowledgeable at this. And so that's something that I want us to kind of think about as I go through this presentation. So when we noticed that a lot of the health coalition groups, and we've been getting calls, or everyone wants to put their flyers to see if they can promote their stuff to the patrons that come to our library, we started participating in health events. And so instead of us waiting on public health officials and healthcare professionals to connect with us, we started going to them. And so we start showing up at programs at our local health center. We start partnering with public health and saying, hey, I know it might sound out of the ordinary, but we would love to be a part of this just to show you what we can provide. And so in that efforts, they saw us showing up at these events. They thought like, oh, okay, you have a lot to contribute. Won't you all become a liaison for our health group? So a couple of groups that I'm a part of is Bull City Strong. This was created during COVID-19 to try to get people knowledgeable about the vaccines and try to get everybody vaccinated. And the Community Health Coalition. And then our role there was not only creating space, but trying to look for people who are in these marginalized communities who, dealt with cancer, whether they had cancer or knew someone with cancer, to be part of these groups, to be a person that could lead these groups. We also reached out to groups and individuals who were doing research and organizing in the field of public health to speak about these collaborations. And so it was a number of interviews and a number of talks. Oh, am I running out of time? Okay, let me keep going. We reached out to all these groups to see if it was doing research and see what we could play a part in it in the public library setting. But then we opened our space to local and not-for-profit organizations to utilize our meeting room space to conduct meetings and programs. And just a small thing, I'll go in and talk about the library and how we're part of this health healthcare movement as well. So just little small stuff just to get them in the building, get them in front of the people, but also, kind of inserting myself to saying, well, this is the library that we serve. We're glad that you all joined us. This is what we play a part in. And so what happened was we had a collaboration with Durham Health Threads, not misspelled that. So please forgive me for that editing tidbit. But the Durham Health Thread is a group of medical students who wanted to do a little bit more outreach to connect with the community. And also, we had the Duke Cancer Institute Community Outreach Engagement Group who came in, did a presentation. But this particular program was led by the community. This gave the opportunity for the community to kind of speak about their experience and, what their trust and mistrust of the healthcare field. And so healthcare professionals can hear out of the mouths of our residents, out of the mouths of our community, to talk about their personal experience and how they wanted to be treated when they're being seen, when it's time to go to the clinic, time to go to the hospital. And so residents spoke about, the origins of their distrust. I could remember one encounter that really touched me. It was B and a guy that was one of the doctors who's in charge of clinical trials. And we were talking about, those questions that you get about voluntarily, being a part of a survey. And the gentleman spoke about how he wasn't sure if he was supposed to do it, because if he was supposed to do it, you wouldn't ask. And that was one of the things that kind of pointed out to us, like, wow, these are people who are marginalized, who we don't see doing clinical research or clinical trials. These are the type of questions that they have. So their reluctance to be a part of these studies is they have these questions and that we didn't know about. And so those are some of the things that we took away from this meeting. But the biggest thing is the language behind it. And so our job as librarians is to get to know the people that we serve and understand the language and the behaviors. And that way we can share with our partners in the healthcare space and say, hey, well, this is a little intimidating. And also, you're not as actively in their face. Be mindful that we're competing with screens and YouTube and computers. And so it's important for healthcare professionals to get in the face of the public. So this event was very successful in the fact that it kind of alleviated the distrust of the healthcare field, because you kind of put a face to what we were trying to speak about in regards to health. So what we learned was we got to create the space for collaboration. Librarians, I know we want to be behind the desk, or we want to be in the library, or we want to wait. No, you got to assert yourself. You got to get out there. Please don't take it for me. And as you can see how I'm speaking, I got a big personality, and I like to go places, and I like to network. And so it's easy for me, but it's also necessary that we get out there and show people we're willing to work with you. And so give us a table and we could promote our work and everything that we do. The biggest thing is understanding who needs to be present for collaboration. So we have to utilize the people that we're interacting with daily. And to know that we have to speak. At our library, we get complaints all the time about us being loud. And that's the people that come to the library and say, well, staff are loud. Well, we have these open conversations with our staff, community people, because we want to know what's in the minds and the hearts of them. And that way we can go back to our partners in part of this health coalition to tell them these are the attitudes of everybody. And so these are how you have to present yourself in order to get something out of them so where we can get our job done to have a more healthy population. The biggest thing is to encourage healthcare professionals to play a major role in community engagement. And so it's a challenge to healthcare professionals. Like, we understand that you got work to do and you have your office, but you have to be out there and be a part of the community as well. So it's a team effort. So you got to come out, join us at the library, go to any kind of community engagement event and be out front facing. But librarians, more so, you got to be a representative of the patrons who you attend. You got to speak their language. You got to know their moods. You have to know their thoughts. And I'll leave with this. And that's one of the things that a healthcare professional asked me if I had any advice for them to help them with their community engagement. And I don't know where it came from, but I just said it. And I said, don't overestimate what you know and don't underestimate what they know. Absolutely, you are expert in your field of study. Absolutely, you can tell them what's wrong with them. And absolutely, you know the things that can help them. But don't underestimate that person's lived experience. That person is an expert as well. That person knows about what's going on in their life and what they're able to digest as far as information. And so we can't judge anybody for saying, well, vaccines take your DNA and judge them on that. This is their lived experience. This is what they know. And they are experts in their lived experience. So, like I said at the beginning, never met somebody that came in the library that wasn't intelligent. So I could be reached at the email below, or you can also call me for more information about my project and what we're doing at the Durham County Library.
Well, thank you so much, Larry. Our third presenter for today, and certainly not least, is Miss Gail McCray. We can all see your presentation now, Gail. And you might want to unmute.
Okay, I have to go back and share again. It disappeared for me. So good morning, everyone. I am just so excited to be here. I submitted an abstract when I saw the call because we're doing a lot of things in libraries, but as Noah mentioned, and we're very guilty of that default position of libraries as a resource and not as a full partner. So I've got to go back and look at how we do things from Morehouse School of Medicine. But thank you for the opportunity to share with you some of the things we're doing. Let's see. Okay. And I have to keep reminding myself of the theme, so helping libraries understand roles in promoting health. So by the end of the session, what I'm hoping is that everyone will be able to discuss a couple of important reasons for libraries to be active and accessible health hubs and increasing health literacy, and also to be able to discuss two ways that medical communities and local libraries can partner to achieve health equity through improved health promotion and health literacy. These are some of there's a document that's been produced since 1979, and every 10 years, trying to look forward to determine where we are as a nation in our health status and where we want to be in the next 10 years. And so in 2020, there was a Healthy People 2030 that was produced. And these are the 5 overarching goals. Now, there are hundreds of objectives in that document, but these are the overarching goals. And I see the library in every one of those overarching goals that libraries can help to eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. That libraries can create a social, physical, and economic environment that helps to promote attaining full potential for health and well-being for all. And libraries can help to engage leadership of key constituents and the public across multiple sectors, as was mentioned in both of the other presentations, really. And so we think about social determinants of health, and these are some of the social or socio-political determinants of health, the non-medical reasons for disease and morbidity and mortality, housing and transportation, access to care, educational achievement, racism is intertwined or interwoven through all of these. Health literacy is one of those social determinants of health, and certainly income. And social determinants of health are the conditions in which people are born, where they grow, where they live, where they work and age, and it's people's access to power, money, and resources. Health literacy, this year or for these 10 years, the definition changed a little bit because it's more than being able to find and understand health information, but it's that ability to use the information that you find. And, again, seeing libraries interwoven throughout all of this information to inform health-related decisions and actions for themselves and others on the personal side. And then in organizational health literacy, it's the degree to which organizations, and we may be talking about medical institutions, but I also see libraries here, in which the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform their decisions. And so the risks of low health literacy include increased medical costs, increased emergency room visits, poor health outcomes. For example, there's a 41% increase in mortality for those in heart failure, or a 12% increase in hospitalizations. There's increased chronic disease and poor self-care for those with low health literacy. And these are the people who are at risk of poor health outcomes from low health literacy: new immigrants, older citizens, one's beliefs and cultures, communication style, poverty, having less trust in their providers or the healthcare system. And anyone can really be challenged by low health literacy. And as Larry mentioned, we all have our professions, so to speak, and low health literacy can be a problem for anyone. We think about, let's say, automobile mechanics, for example. Even though physicians are intelligent people, they may have low literacy in mechanics or low financial literacy. So it's the kind of literacy you're talking about, or even, if we have someone who's sick in our family or we're sick ourselves, our ability to navigate health information declines when it comes to personal illness or suffering. So anyone can suffer from low health literacy. And so who's responsible for improving health literacy? Health providers, we all are. Patients, care partners, families, organizations like medical clinics, hospitals, libraries, and then overall communities. And so we're seeing over and over where libraries are a standout in improving health literacy in our communities. And so, how do we improve health literacy among providers, among community health workers, and in healthcare systems? And a lot of it is about trust. And I heard trust mentioned in both the other presentations. Um, and trust is seen, in a lot of different ways, but people respond to trust or lack of trust by participation, whether they attend the library, whether they're treated well or treated with an indifference, or that trust, and then whether they're given reliable information and information that can be helpful to them. So yeah. And so we have to, especially in um, this day and time, the current atmosphere, have to be creative about how we seek and how we use health information. And, whether it's information that comes from providers and health facilities, is the information complete? Is the information, you know, uh, is it personalized information, or is it general information? Um, Same thing for the libraries. And, I'll talk a little bit more about community health workers and how, the role that they can play and the role they can play in partnership with libraries. And, we have to be careful about Dr. Google and AI. We have to be careful about politics and the health information that comes, not because it's evidence-based information, but because of whatever, political reason there might be for that, or personal reason. And so the roles of health literacy and achieving health equity, there were a series of meetings in 22 and 20, between 2022 and 2023. And the panelists discussed the relationship between health literacy and trust in public health institutions and clinical settings and community settings, and with community health workers and really youth ambassadors who are focused on health. Some of the important recommendations are that we use plain language, that we use the audience's preferred language and communication channels, and that we use culturally and linguistically appropriate language. Again, a lot of this information was designed to address health institutions or medical facing institutions. But the same thing is true of libraries. And as I listened to Noah's comments about, community health coalitions and, that the level of engagement of libraries, I, um, you know, thought about how these things apply also to libraries and library staffs. I have to say that, while I never really considered libraries as partners, and we're in the libraries, community libraries a lot, I think part of my reason was that the library staffs seem to be so limited, and they always seem to be very busy doing what they do. So, I really interact with them not very much, but to the extent where we can, exchange some health information and they can give me direction. But, maybe we can have some discussion about that. And so, partners in health literacy and health equity. So, a community health worker is a frontline public health worker who's a trusted member, that word trust again, and has an unusually close understanding of the community that's served. Same thing about libraries. The trusting relationship enables the worker to serve as a liaison or a link between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. I'm talking about community health workers. That's an incredible workforce. But again, as I read the definition of a community health worker, I see, the library as, part of that community health worker workforce. You develop, or librarians and libraries develop a relationship with their community. They know the culture of the community. They know the people who are in that community and who can and will attend the library, whether it's as an individual or attending meetings. And those social determinants of health, transportation is less of an issue in getting to the library. That generally they're very accessible. Uh, they're free to attend. So, a lot of the social determinants that keep people from health information and improving their health status are there and within the library. So, both community health workers and libraries are underutilized health information resources. They both assist with healthcare, can assist with healthcare access, improving specific skills related to health literacy, providing education. I included the at home because, community health workers, many of them are in the community. Some work from healthcare facilities and in hospitals and so on, but there are some who do make at-home visits, and I could see community health workers utilizing the library more for group meetings and to exchange information about health, different areas in health and access to health services. Extension agents, cooperative extension agents are also folks who are in the community and provide health information and can work with libraries to provide information on disease prevention and management, reading nutrition information. So these are partnerships that could uh, develop and be very useful to community and improving community health. With as rural health assets, libraries are trusted resources of information, free access to digital and print health related resources, show people how to use and access health information or health related information and digital resources on computers. They can provide referrals to other organizations. They can distribute information about local health-related events, and they can help to conduct research about health topics that are requested by community members. At Morehouse School of Medicine, we do a lot of community engagement activities, and our mission is leading the creation and advancement of health equity to achieve health justice. And I'm in the Department of Community Health and Preventive Medicine, and we have a number of community-facing programs with community engagement and community-centeredness, like patient-centeredness at its core. Prevention Research Center, it's the CTSAs are all over the country, the Clinical and Translational Science Alliance. And what that is trying to get health information and research from the bench to the bedside and to the curbside. So much of research is done in institutions, and academicians do the research, publish the research. The research, the publications sit on the shelves, and often it'll take 15 years for the information to get from the evidence to being utilized at at the end point where the research is supposed to help. So the CTSAs are supposed to help to cut through all of that. Again, seeing the library in all of this. Georgia's SEAL, which is a community engagement, SEAL is Community Engagement Alliance to reduce COVID disparities. We've got a community-based clinic, and then we have a community health course that is for first-year medical students. It's a required 2-semester course, and they go into the community, and the first thing they do in first semester is community needs and assets assessments or mapping. And of course, libraries, whether they are there or not, is at the core of that. Does this community have a library? And how is that library utilized? Is there a way to utilize it as a health resource? But this is a part of also educating physicians in training on how to work with communities to improve community health, ultimately public health, and certainly individual health. So again, I think I mentioned most things here that libraries can help to reduce or eliminate some of the social determinants of health. They can increase the capacity of the community to become full partners in research and demonstration projects. They can increase access to reliable information. Today, patients and communities are required or expected to know so much more about their own health and take an active role in their treatment regimens. They're expected to take their own blood pressures, their blood sugar readings. They're required to do self-injections at home to manage and monitor complicated medication regimens. There was a time when physicians wouldn't allow nurses to take blood pressures. Things have truly changed, and if you don't have some level of health information or a way to get it, then you're not going to have the best outcomes for your health. And then this last one, I think I also mentioned, they have to also learn, and libraries can be very instrumental in this, in navigating misinformation and disinformation, and that disinformation being the deliberate dissemination of erroneous health information. Again, Dr. Google, AI, politicians, vaccinations, the issue on Tylenol and pregnancy. We really do have to be careful about where we get our information. And I think libraries can be at the center of that in our communities. So they can help in the areas of research. Mentioned coalition and steering boards, being a part of the coalitions or steering boards, but we have our meetings in the libraries because, again, they're very accessible, and we have to go back and talk about partnerships with libraries. We do have consultations for community-based research from other major academic institutions. These are just some of the activities that we do. And with our community coalition boards, they are true partners with the academic institutions and help to decide, for example, what research is allowed or disallowed in their communities. And if there are parts of the research protocol that are not befitting. Essentially, community coalition boards establish their own IRBs, the institutional review boards, and review the protocol and see if it's appropriate for their own communities. So that's just another way that communities are centralized, and libraries can be a part of that. We do education and trainings in the community, host grant writing academies for community-based organizations or individuals who may want to do health promotion projects in the communities that they know best. Workshops on how to establish and maintain nonprofit status, and libraries nationwide. The organization Candid is an organization that holds lots of information on nonprofit funding sources. And the subscription to Candid can be very expensive, but public libraries do have that subscription. And, it's a place where we can all go to figure out what organizations or what funding sources might be appropriate for projects that we want to do. Again, more workshops, civic engagement and public policy training, mental health or first aid, specific trainings on diabetes and cancers and mental health. We have a program called TLC, Talk, Learn, Collaborate, stress reduction, health literacy, the urgency of now and next, which is a community meeting on policy advocacy and health. And this is a specific example of a rare blood cancer disease that holds their monthly support group meetings in libraries. So for new and old members, it's easily accessible. The meetings have been hybrid since COVID, and the technology to host those meetings is available. Libraries can help raise awareness about the importance of a rare disease or health conditions. They can help disseminate or display health information, publish in partnership with other health entities, reliable health information, and engage library staff to determine additional innovative means of community engagement. So from the library side, community academic libraries should engage in marketing strategies to inform and highlight all the different health resources they can provide. They can provide examples of exemplary programs as my partners have done this morning. They can invite community engagement departments of academia or medical schools to increase their health programming and their presence. And they can remind others of their role in reducing and eliminating barriers to care and information resources. From the academic side and healthcare service side, can recognize the value of community libraries in closing gaps in information technology services, and can find creative ways to highlight patient and community centeredness in care. Libraries are a democratized site. It doesn't matter your background, your belief system. You're invited to be present. They are embedded in the community and are a trusted resource. They have a well-trained staff open to hearing your organization's needs and working to partner with you to address those needs. They're physically accessible to community members. The geography, the scheduling, the parking, handicapped accessible. They're financially accessible. It's paid for through tax dollars. The technology can reach within local communities and nationally for those who don't have access to resources at home, and a wide inventory of health resources. So health equity is the attainment of the highest level of health for all people. We will achieve health equity when everyone has the opportunity to be as healthy as possible. Thank you so much.
Right on time, Gail. That was perfect. We would like to open up the Q&A portion now. So if you have not already submitted a question via the Q&A, please feel free to do so. And I'm happy to let us know. One person had asked for contact information, but I do believe that that was already provided by Julie on chat. Our first question is for each of you. So if you'd each like to take some time answering. One of the participants said, I am a social worker at a library developing a program there. I really appreciate hearing how libraries are pushing to partner with healthcare communities. How do you all feel about social work student interns being placed in libraries, and how can social work show up in your own libraries? I'll also place these in the chat in case anybody is more comfortable reading the question as you pose an answer.
So I will say that I'm not a librarian at all. And so I will allow my co-presenters to speak.
That's a great question. I could take it away. Actually, it's funny that you mentioned it. We are in the beginning stages of offering social work counseling at our library. The only thing that's holding us up is the language behind what the School of Social Work at UNC Chapel Hill is asking us to do. We have to go through county legal, and that's the biggest hurdle, is being, going through the legal channels of what is the library's part, what is our space part, what part do we do in participating, is there privacy, consent, and doing things within a public space is one of the major holdups. And also, how long are you going to be able to do it? And so with that, we, like a lot of libraries across the country who have social workers who work in the library, we wanted to take a step further and try to provide counseling for our patrons who come to the library. If you work at the desk, you get a lot of conversation with people who have a lot of challenges. And we always say, like, look, man, we're not your counselor. And so we want to provide those things, but there's the legal barriers that keeps us from just going on and just doing it. So yeah, great question.
Thank you, Larry. Noah, did you want to add anything?
I would just add really quickly by making a plug. I saw on the agenda there's a session tomorrow on Stony Brook Medicine's Healthy Libraries program, which involves social work interns, but lots of other interns as well. So they have nursing students, they have public health students, they have physician assistants. So I think within public libraries, there's a big conversation about social work interns, but I think we could be dreaming bigger. We could be thinking more broadly about what other students and what other health fields we can be kind of connecting with our libraries. So would definitely encourage taking a look at that session to get some ideas of what's social work and more at libraries.
Thank you for the plug, Noah. I know one of the participants, particularly on there from Stony Brook, is one of the, I would venture to say, leading voices in the nation on social work in libraries, Ms. Leah Topek-Walker. So thank you for that. We did have an attendee here today. Just note that as a library social worker, they'd love to have a social work intern, obviously under the supervision of a licensed social worker, but there's no social work school close enough by. I think they're saying that is just kind of adding into the conversation. Next, for our panelists, the question is, we currently promote health literacy and access through things like hosting a mobile mammogram van from our local hospital and holding workshops about fall prevention, for example, and things like yoga and meditation. There's a struggle for some of these is often getting people there, and they may say that they're interested but don't. Can any of you lend any perspectives possibly to that?
Are you saying that the community participants are not able to get to the library? Is that what you're saying?
I think it's more the community has expressed interest in those things, but then does not actually show up. And I've seen that too in my work. So if any of you have anything to lend to that about.
Yeah, and it is always an issue. But one of the first things I'd say, and it's not really implied, maybe it's not addressed, is that you ask the community for the topics. And so, that's part of the assessment that's done. So we know at some level the community is asking for it. I would say another thing that we all face in meetings that are not specifically what we think we might have an interest in is that the education be coupled with maybe other meetings where that might, convene at the library, but, sort of be on the agenda of another meeting, so we already know that there's a core group of people there. Those are the two things that I think about first.
The other person added in that no, they just don't come to.
Yeah, and of course, food is also one of those uh, incentives. Uh, it's community. We don't know the scheduling. If it's at 3 o'clock or 5 o'clock, if it's, the audience, there's no guarantee that people are going to come out of their homes when you say there's an exciting topic going on. So we have to do our part if we're wanting people to access the information we have, and just continue to do our best with that.
I think you hit on a good point, and someone else pointed out too, the transportation as well. That is a huge issue, and they also said as is communication and publicity for specifically for health and mental health programs. So I think those are all competing factors amongst, like you said, is someone going to actually come out that day?
And I want to add as well, and especially a special thank you all for particularly having a mobile mammogram van coming out. That is huge. We have had challenges in community engagement as well. But one thing that I'm always encouraged by is if one person shows up, that means they really need it. So do not. I know it can be discouraging that you don't get a lot of people to come, or people ask for it but they don't show up. But one or two people may come, and that means that they really needed it to be there. So continue to do it. Continue to do the work. Continue to have it accessible, because it might be that one day that they might decide to be there, and it's there.
And
Everybody
another,
don't. Go ahead, Miss Gail.
I'm sorry, I didn't mean to interrupt you. Go ahead.
No, I was going to say, we Noah talked about the digital component. Everybody doesn't think they need a computer or a copier till they need it. And my printer went out. I need to print this bill out. I need to print this check stub out so I could get an apartment. Thank God that y'all are open. Thank God that y'all are here. And it's just like the hospital. Nobody plans for an injury. Nobody plans to be sick. Nobody plans to have a disease. But we are very thankful for those communities who have them. We're very thankful for those clinics that we probably drive past a million times. The million and first time we might need to go in there. So continue to do what you're doing. Don't get discouraged.
Yeah. And the only thing I was going to add to that is that community engagement, so that they know you and trust you, and that your event is going to be one that they'll miss out on if they don't get there. Community engagement year round is important, and not just when there is a topic or an event. We host a community engagement day, is what we call it, which is, essentially a lot of different health screenings and health information, information on workshops on AI and other things of community interest. But they know that there are also going to be some door prizes and gift prizes. And so if there's a way to have raffles, because, there's generally not a lot of money involved, raffles for $25 gift card, or, bags of groceries, or what's needed in addition to the information. So even having sort of a combination information fair and groceries, or what am I trying to say? Fresh fruits and vegetables, that they can take a package home.
I love that suggestion very much, Gail. And I just want to add, as we curtail this question to the next, and someone said communicating and coordinating with local politicians to publicize can be very helpful. I think given all of your presentations, we each agree on that, but thank you for the reminder to put it in there. The next one I think is a fairly important question, and if you'll all lend your perspectives, and I will of course put it into the chat for everyone to see, but I work in a large urban public library, and a lot of bigger picture things like joining a coalition, I don't have power over. Do you have any recommendations for advocating for these types of health programs to higher ups who are not on board?
I can quickly jump in. So this is not necessarily going to solve all your problems, but if you reach out to me, I'll send you the process that they developed at the the Akron Summit County Library in Ohio. So starting in 2014, they actually developed a process where if a full-time staff member wants to go to a community coalition, they actually have a community engagement proposal form that a staff member can fill out and say, hey, we need to be at this table. And so I'd be happy to share that form with you, and you can in turn take it to your admin team. But sometimes it's helpful to say, like, here's what other places are doing. So Akron Summit County Library, they've had a successful process for 12 years. Where they are empowering staff members across the institution to go and participate in coalitions. So you could take that information to your admin team and say, like, it's worked for them. They've been really successful. It's dramatically broadened their reach. Can we do something in our system? So happy to share that. But that's what I would recommend. Yeah, use other people's success to advocate for change in your institution.
Thank you so much, Joe. And it seems you have some buy-in from that. So if you will kindly share the form when you get a chance, that would be wonderful. Larry or Gail, would you like to add in about buy-in from higher ups?
No, I like that. He's got the information. So yeah.
Fair enough. The final question at the moment in the Q&A is more just from a new library student, just appreciating the new information and how traditional libraries have now expanded to include social workers, specialists to help patrons of all kinds. These subjects have broadened the knowledge, and they're currently writing about like intimate partner violence this week, so it's been very helpful. I think there's been a turn of a lot of this information starting to show up in library schools. I know two of you teach and work in library schools, so maybe you each want to impart something as we are coming close to the end of our time on what you might say to new library students and new folks in this field about adding these types of health equity lines into their work.
I mean, I always tell my students, we may not have it all together, but together we can have it all. And that's I think, an important message. I think a lot of librarians, when they think about this topic, they imagine, oh, we need to do it all by ourselves. We're alone. We have all these issues kind of coming into our doors. We don't know what to do with them. We may not have it all together, but together we can have it all. And I think that's an important message to really think about when we think about how libraries can improve the health of their communities.
And I would also like to add as a hiring manager, I always tell anybody, I don't care what profession or anything, like, don't try to be like me. So don't try to do what I did, do what you do. There's enough of me's, there's not enough of you. So to the library students everywhere, you have a fresh, new energy, new ideas, please provide them. Because it's very much needed. There's a great demand in innovation. And so please continue to be innovative, continue to think out of the box, stretch us to limits that we haven't seen. Take this and build on it. Okay, we thought of the social work thing. What about psychiatrists? What about other medical professionals and healthcare professionals who can assist with mental health? Let's think beyond where we are and go further. So that's what my advice is to any student within any profession.
And I'll just say the same thing. Again, I'm not in a library. I don't work in a library, but my mother was a librarian by profession. She was the only librarian in my small town in Georgia, only librarian for the Black community. The library was segregated, and we couldn't go to the other library. And so I grew up there, and then she became school librarian. But the innovations, the things that are changing over the decades, and the need for libraries to take their place in helping to, and it would have to be from your perspective, um, take your place in the coalition of health promotion experts, so to speak, because you have so much resources that are not, we don't know about them and we don't share them. And so, yeah, that would be my statement.
Thank you all so much. And we are properly right at the end of our time. We do have a moment if any of you would like to just add a quick closing statement, though those were perfectly suited for, I think, each of your presentations. But I'll lend it over for a moment before I give our closing remarks.
I just wanted to say, yeah, thanks everyone. Thanks Larry. Thanks Gail. Thanks Alicia, Hillary, Julie. It's great to meet all of you, and let's stay in touch.
Also, I want to thank everybody. Thank you all for putting this event together. I mean, I never thought that I would be doing a presentation that involved in this. This is a testament to, if you do the work, you never know when your name will be called in that work. So thank you for putting this together. I'm looking forward to the rest of this conference. It looks like it's going to be an exciting time with a wealth of knowledge and connected with individuals who are doing amazing things. So thank you.
Thank you all so much. I've learned a lot and look forward to putting some of the information to work.
We truly have a great lineup coming up for the rest of today and tomorrow. So thank you again to all of our presenters. You were absolutely wonderful. And thank you to our audience for attending. So we are committed to ensuring that SRRT's programs are diverse, inclusive, and free for attendees. So in order to do so, we do rely on support from ALA, membership, and direct donations. So you can help champion our roundtable's mission and commitments by donating to the link that is provided. And or by joining SRRT as a member and even helping to plan some of these wonderful events. So you can make a general gift or select the SRRT task force or award that you would like to support. So please help us if you can to maintain our high quality programming and the core values mostly that sustain it, and our commitment to accessibility by making a donation, becoming a SRRT member, or helping to spread the word about our roundtable and events just like the rest that are coming up. So thank you. Our next session for today is going to be quickly coming up at 10:15 a.m. Central. And it's going to be what matters to autistic students in school libraries. And it's going to start, like I said, just in a little while. And I hope that you can join us for that session or any of the other wonderful ones coming up in the next couple of days. So thank you so much. And I think we are all set, Hillary.